Hello, my name is Mohamed Osama. Uh, Today I am honored to present my work as part of this conference. A few months ago, I was at the hospital on a busy day. We had lots of emergency cases, one after another, and this is not uncommon. But this time, we had so many cases that the CT scanner started to overheat. The problem here is that it risks making some patients wait more time to have their scans, and subsequently their diagnosis and management might be delayed. I started to think, can we prepare for these events? I decided I needed to collect some data. This brings us to today's topic, temporal patterns in radiologic imaging across a multi-center university hospital network in Alexandria, Egypt, a 6-month retrospective analysis. As we all know, emergency imaging is vital for urgent cases, surgical and trauma, especially abdominal and pelvic CT. However, due to the large number of scans requested daily, hospitals often face heavy strain, especially during certain time periods. Identifying these periods may help us better prepare for them. My hope is that understanding workload patterns would help us prevent delays, reduce burnout, and maintain service continuity in high-volume, resource-constrained settings. The objectives of this study were to quantify the radiologic workload over a recent 6-month period, to identify temporal surges and low-volume periods, and to highlight implications for departmental planning, maintenance, and staffing. I was able to perform a retrospective data review using our internal PACS system. This is a screenshot of the PACS system interface. We can see it is divided into each of our university hospitals, and each of these hospitals is subdivided into each radiologic modality, whether CT, MRI, or X-ray. Below this, we can see the list of patients, each with the date and time, the type of modality, their age, and other details. The study was conducted over a period of 6 months, from November of 2024 to April of 2025, and it covered our 6 university hospitals, Al-Miri, Al-Shabbi, Smuha, Al-Muwasa, Nariman, and Burg Al Arab. The data points were monthly totals, daily averages, holidays, Fridays, and Ramadan timing. I analyzed a total of 21,748 cases, both CT and MRI, which were performed during the 6 months. It turns out the daily average is about 120 cases every single day. Of these, CT formed the majority, with MRI constituting a quarter of the scans, equivalent to 5,851 studies. If we look at this line graph, it shows the number of scans performed each month. The lowest month was November with 1,896, and April was the busiest with 4,380 scans. April was more than twice as busy as November. Moving on to this bar chart, it shows us the average number of cases performed per day. Again, the overall average was 120. However, the highest month was February with 151 scans, and the lowest was November with only 63 scans performed on average each day. This brings us to one of the more interesting findings of the study. Imaging volumes dropped substantially on public and religious holidays, with only 40 to 65 cases during Eid and 24 scans on January 25th. The average Friday volume was markedly lower than the overall average, about 53 scans on each Friday on average compared to 120 scans per day during weekdays. During Ramadan, the total number of scans performed was 3,692, and most of these were performed during fasting hours, about 76.6%. equivalent to 2,992 scans during fasting hours and only 700 during non-fasting hours. So what are the takeaways from this study? One recommendation is that we could encourage clinically justified imaging only. Every unnecessary scan could increase waiting times and put our machines and staff under greater strain. We need to prioritize cases that need imaging the most. One suggestion is to use evidence-based guidelines such as the American College of Radiology's appropriateness criteria. These appropriateness criteria cover over 3,700 scenarios, and they recommend specific radiologic modalities for each clinical scenario. These criteria are updated each year by a panel of experts, and one example here is an adult with acute respiratory illness. He is immunocompetent with positive physical examination or abnormal vital signs. The recommendation as per the appropriateness criteria is only an X-ray of the chest. Another recommendation is we could expand the study to a full year or more to capture seasonal variation. As we approach the summer months, the number of patients and the high temperatures are expected to affect the workflow more negatively. The third recommendation is we could update our internal PACS system to show more details about every study. This would help us with future studies to assess which type of imaging is more in demand in each time period, similar to how CT chest demand surged during the COVID pandemic. In conclusion, radiologic imaging volume across our multi-center Egyptian hospital network demonstrated important temporal variation with reductions during holidays and changes in case timing during Ramadan. These findings can inform evidence-based staffing, optimal scanner utilization, and timely maintenance scheduling, helping ensure continuity of care during high-demand periods. Thank you.